Hello and welcome to this podcast, brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm, Chairman of the Isle of Man Anti-Cancer Association and a former surgeon.
And my name's Sandy. I'm the Executive Officer of the Association and a cancer survivor. The Association has posted a series of podcasts on this site with a cancer awareness theme aimed at providing listeners with information about the signs and symptoms of specific cancers to encourage early presentation as a way of improving outcomes. We have asked that in those who recognise that they may have relevant symptoms or signs to visit their GP or practice nurse at an early stage and discuss any concerns they may have.
In this series of podcasts, we want to look at the various stages of the journey those presenting to their family doctor or practice nurse may set out on. In the previous podcast in this series, we talked about the initial referral process for someone who felt that they might have an early tumour. In this podcast, we want to talk specifically about what investigations might be carried out.
When you see your family doctor or practice nurse, they will ask you about what concerns you have and probably examine the area of your body affected, as they would normally do for anyone they see with a new problem. It may be easy for them to rule out anything sinister going on at this stage. For example, you may have a simple benign cyst on your skin. They may also request some routine investigations, such as blood tests or x-rays, and possibly an ultrasound. GPs sometimes can request more complex investigations, such as a CT scan, when certain criteria are met warranting such an urgent investigation.
The primary aim of these investigations is to assist your GP in determining whether he or she can rule out the possibility that you might have cancer. The tests might show that all is well, or that you have some other medical condition which they may be able to treat or refer you on to the relevant specialist. If they feel that they cannot rule out a tumour being present, they will refer you to a specialist through what is known as the cancer referral pathway. This may be to a specialist outpatient clinic, such as the breast clinic, or for a specialist procedure, such as an endoscopy, aimed at speeding up the diagnostic process. There are a number of one-stop clinics in place these days that allow a number of investigations to be carried out and reported on in a single visit, allowing many patients to be able to leave the clinic knowing that they do not have cancer.
The specialist is basically tasked with answering the question, does this patient have a cancer? There are often clues in the story the patient tells the specialist about their illness. The look or the feel of any visible or palpable lesion, or even from images of the lesion on an X-ray or ultrasound that suggest or indicate that it is not a tumour, or maybe that it is. Skilled clinical judgment, in most cases supported by proven graded scoring systems, can lead to the specialist to rule out a cancer diagnosis at this point. If the clinician cannot rule out the possibility that a tumour may be present, they will seek a definitive diagnosis through obtaining some tissue from the suspected area.
There are a number of ways tissue can be obtained. The simplest is by aspirating a small sample of the lesion using a needle and syringe known as a fine needle aspiration cytology. This is then smeared onto a slide, stained and examined under a microscope. The advantage of this technique is that an answer can be available in half an hour. However, it can be extremely difficult sometimes to interpret the slide, and it gives very limited information about the tumour.
A better way is to do what is known as a needle core biopsy. Some local anaesthetic is put into the skin and overlying tissue. A very small incision is made in the skin and a needle passed into the abnormal tissue and one or more samples taken. The needle is often attached to a small handheld device which is triggered by the operator and removes a 1 to 2 millimetre core of tissue. For deeper tumours, the needle may be guided into the tissue using ultrasound or X-rays. It does take several days to process and examine the tissue. However, with the greater amount of tissue obtained, a more definitive diagnosis can be made and more information is readily available about any tumour present.
On occasions, surgery may be required to remove part of the lesion, known as an incisional biopsy, or all of it, known as an excision biopsy. This latter is particularly relevant for very small lesions. The surgeon may be guided to the relevant abnormal tissue by a fine hooked wire inserted under local anaesthetic, with guidance using ultrasound or X-ray just prior to the operation.
For patients presenting with evidence of some form of blood cancer, an initial diagnosis may be made by examining a drop of blood smeared onto a slide. This is often followed by aspirating some of the tissue from the bone marrow to truly get a full picture of the tumour. This is usually carried out under local anaesthetic, with a sample taken from the hip bone palpable just below the waist on either side.
If a diagnosis of cancer has been made, then further investigations will be carried out, some of which are aimed at determining the extent of the disease, in other words, how far it may have already spread. These can range from blood tests looking for abnormalities that could suggest disease in different parts of the body, to further scans and X-rays of a variety of organs, which may include CT, isotope, MRI or PET scans.
Investigations are also started to assess how fit a patient is to undergo treatment. These include routine blood tests to assess the level of cells in the blood, kidney and liver function, chest X-ray and ECG for lung and heart function. Many individuals with cancer are elderly and may be asked to complete a quality of life questionnaire to enable clinicians to understand the extent to which they may be able to tolerate certain treatments, some of which may be quite challenging to them.
Throughout this investigative stage, the specialist doctor or nurse will explain the need for the tests, how any procedure is undertaken, any preparation that may be required by yourself, as well as make you aware of what you might feel and any potential side effects. Remember that most patients referred will have had a cancer diagnosis excluded. Those that receive a cancer diagnosis will move on to a discussion around treatment.
There is more information available at the Macmillan Cancer Information Centre at Nobles Hospital. You can phone them on 650735 or you can visit their website at macmillan.org.uk. In the next podcast in this series, we will discuss the staging process and treatment options. Thank you for listening.